Show on KSLA News 12. Today is Miracle Monday, and we're talking about flu season and how the Children's Miracle Network Hospital System with Christus Health is helping out in the local area. Joining us today is Dr. Gretchen Hometown. She is a doc mom, pediatrician, and mother. And welcome. You know, flu season is such a hectic time and an overwhelming time because when somebody goes down in a house, it's pretty quick and swift. Talk about the symptoms of flu for us.
Well, you can have the same symptoms of flu as common cold. You have a runny nose, congestion, fever, but the flu is usually more severe, and so you may have really high fevers, some chills, body aches. Some people, you know, they'll vomit and have diarrhea. But the scary thing about it is sometimes you can't tell the difference between the common cold and the flu.
So good time to call your doctor and get things checked out, particularly when we're talking about little people and especially those very small patients who can't speak for themselves. But when is flu season? Are we in it right now? Is it different every year?
We actually are. We see flu cases as early as October, and then it can span up until May. Some years it's unpredictable. You know, we may see some flu cases beyond May, but typically October to May. But you see most of your cases around January, February, so after the new year is when it typically peaks.
Okay, so what about the flu shot as it pertains to children? Should parents get the child vaccinated? Or?
Most definitely, and I can speak on this in two fashions as a mom and as a physician. My 4-year-old Dylan, he had the flu about 2 years ago, really high fever, he missed school, he was pretty sick for a couple of days. So as a mother, I have seen the results of the flu, and it's really important to get, you know, your children vaccinated because it can be really severe for them, and, you know, it can take them out for a few days before they recover. Now, as a physician, the flu vaccine is really important because it helps to prevent the spread of the flu. Prevention is the key, and in any age, especially pediatrics, prevention is the key, especially for our smaller kids, because if they're less than 6 months of age, they cannot receive the flu vaccine. However, if they're to receive the flu, they're in an age group where you can see severe complications.
Absolutely, and it's important for everyone to practice prevention. I know hand washing. What can we do to prevent the spread of flu?
The most important thing, again, is get vaccinated. According to the Center for Disease Control, they have a Take 3 slogan. And the first step is, again, flu shot, or flu miss. So your flu vaccine is number 1. Number 2 is the prevention, hand washing, cover your coughs and sneezes. It's really important. And then number 3, if you're to get the flu, make sure you're treated appropriately.
Absolutely. And we talked about the shots, the vaccine, if you will, the mist for that option. There are myths out there, though, about flu shots every year, and I'm sure as a physician you hear them.
I hear them every day. And the most common myth is that, oh, if I receive a flu vaccination, it gives me the flu. And that's absolutely not true. You know, most people, you know, they may have some side effects with the flu vaccine, but they're typically mild, and they may range from a runny nose, a cough, or a sneeze. But for the most part, the flu vaccine does not give you the flu.
And what about some parents who say, oh, I don't want to hurt my child, I don't want to have to give him or her a shot?
And as a mom, I totally understand that, but, you know, it's quick, you know, and we have experienced nurses who can take care of your child, and it may be a little discomfort for just a tiny bit of time, but overall, what's a small second of discomfort compared to a week-long, you know, stay of the flu, you know, so you have to kind of outweigh your options. It's uncomfortable. They get over it. We love on them, and they're fine. And I would take that as a mom over having to deal with influenza in either one of my boys again.
It is Miracle Monday. Christus Pediatrics Associates is one of Christus Health's Children's Miracle Network Hospital's 17 signature programs in this local area. And we are so fortunate to have all of these 17 programs. So your practice is just one of them, helping families in our area.
Exactly. We're Christus Pediatrics. We're a group of 4 physicians, all board-certified pediatricians. And we're really excited because we recently moved to a new location, which is 1549 East 70th Street. It's across from Barksdale Federal Credit Union, and we are so excited to provide extended hours for our families now. So we are available until 7 o'clock on Monday through Thursday evenings. And then on Fridays, we open until 5. And on Saturdays, we also provide hours between 8 and 12 p.m.
That's great, because families, as you know, as a doctor and a mom, are always on the move and need to see their doctor outside of regular business hours. And that is such I guess, a unique perspective you give to your patients, that you've got those little guys at home and you know what that mom's going through as well.
Exactly. Again, as I alluded to previously, Dylan, my now 7-year-old, when he was 4, he had influenza, and it was horrible. And then as a mother, going back to our extended hours, my 3-year-old David, he's also been sick a time or two himself, and I've had to utilize those extended hours myself as a mom.
Absolutely. Well, Dr. Gretchen Petaway, thank you so much for joining us. And again, she's with Christus Pediatric Associates, and we're just so glad to have you for Miracle Monday and letting everyone know to take prevention and prevent the flu this year.
Thank you for having me.
All right. That is your Miracle Monday episode for today. If you want more information on the Children's Miracle Network hospitals in our area, go to ksla.com and click on that Miracle Monday tab. That is your hometown show for today. I'm Kelly Johnson. Have a great day.